What healthcare interoperability topic are not enough people talking about?
Well, interestingly enough, it's kind of along those lines. I think that community information exchange, which is typically around the social determinants of health data, and that integration with a health information exchange is, there's a few organizations that are doing it, but I think it's not being talked about enough. But I think a lot of people want to do it or figure it out. So not every community has a community information exchange, but a lot of HIEs are looking at least collecting social determinants of health data. But I think that CIE, the Community Information Exchange, takes it to a whole other level where it's really making that data actionable. And I think that's the missing link sometimes with SDOH data, and part of the reasons why providers are sometimes hesitant to collect it and share it. So I think that's the big interoperability topic we all need to explore a little more.
My favorite thing, usability, workflow, what happens in real life, on the ground, the people who are interacting, because we see or hear so many stories of organizations talking about these great things that they're providing. We're doing this for our providers or this for this customer, and but do you really sit down with them and really see how is it working ideally the way you think it is, and are they getting the benefit that you think they are, and what's left to be done? So I'm really excited about, if you have seen Sequoia and AHIMA have partnered on the data usability taking root, really to get at that end user perspective. So I'm hopeful that that's a great effort, because I think we forget to get to the workflow level step by step to really see how it's used.
I think the thing that is most important about healthcare information exchange in general terms is trust. So people don't talk about the fact that, particularly in this group of folks who are trying to make these TEFCA decisions, if they're going to be participants under a QHIN, the QHIN is going to have to do something to mitigate their risk associated with these partners that are beneath them. They have the common agreement that they have to abide by, but they also need to take care of their cyber health. And so that, I think, is the really big piece. The other piece is that the trust and identity that is going to be required in a TEFCA that goes FHIR. So once we go to FHIR, the model is going to be very much different than it is today. Back to the first question about TEFCA and what's happening there. Once we actually go to a fully blown FHIR model, it's really unlikely that it's going to look anything like it looks today. And so really excited to see that happen, but it will definitely require a serious trust mechanism for that to work.
Well, I think it's the adoption out of the gate, because right now with TEFCA, the initial use cases are just treatment and individual access, and people are exchanging successfully, very successfully, for treatment purposes. And so down the road, we're going to be adding additional use cases, but the adoption is something that we really want to try to get people to do prior to those additional use cases, so that more value can be added more quickly as these other use cases are brought on board.
Data quality, patient identification, it really is the core. We're doing all this great work to bring data sets together, but to make it usable, informational, and actually to keep the patient at the focus, we got to think about the quality of the data before we do more data exchange.
Yeah, I think one of the things that I'm really interested in this area is that we're working with standards today and pushing the boundaries wherever we can as health data utilities. But as they continue to formalize and get adopted within the industry, I think it's going to be really fascinating to see what other use cases can be done under the health data utility model that wouldn't have been possible without those standards being adopted and available.
Well, I think listening to our customers and our participants, right, that's a key area. A lot of times in health IT or any exchange, we think that what we know, what our clients want, or what the hospital system or a clinic or a payer wants. But a lot of times, if we don't listen to them on their certain issues or certain pain points, how can we really drive change? So I think really listening to them and then being able to make that information in a positive way, that's how we're going to make change and continue that movement.
I would love to see more people of the spirit of Team Interop and talking about collaboration. This conference in particular focuses on public-private partnerships and collaboration, which is amazing. But I'd love to see it go a step further and talk more about education opportunities and what we can do to share information that we have and the technological capabilities that we have. It's not, as we heard today, it's not necessarily an innovation problem. It can be an implementation problem. And how have we implemented the things that we have existing today? So I'd like to see more people talking about that and collaborating to share information, strategies, et cetera, and of the spirit of Team Interop.
Awesome. Thanks, Kathryn.
Thanks, John.